Okay, these next three chapters we're going to cover really quickly. This is just information that you need to know for the EOC and that we didn't quite get to this semester. So again, I'm going to crank through these pretty quick. So first thing we're going to talk about chapter 21, which is tobacco. Tobacco is the number one cause of preventable diseases and death in the United States. What makes tobacco so dangerous is that it's an addictive drug, which is a substance that can cause psychological and physiological dependence. The addictive substance in tobacco is nicotine. It is classified as a stimulant, which means that it increases the action of the central nervous system, the heart, and other organs. So it raises blood pressure, increases the heart rate, and can contribute to heart disease and strokes. Inside cigarette smoke, we have carcinogens, which is a cancer-causing substance. Any tobacco has carcinogens in it. Then you have cigarette smoke that contains tar, which is a thick, sticky, dark fluid produced when the tobacco burns. And what it does is it destroys the cilia, which are the hair-like structures in the lining of the upper airway that helps protect against infection. It also damages the alveoli, which are the air sacs that we talked about earlier this semester during the respiratory system. Then we also have carbon monoxide, which is another compound found in cigarettes, which is a colorless, odorless, and poisonous gas. And what it does, it is taken up more readily by the blood than oxygen, and so therefore it replaces oxygen in the blood, therefore depriving your tissues of the oxygen it needs. Cigars and pipes you need to be concerned about because cigars have significantly more tobacco in them. So a single cigar can have as much nicotine as a single pack of cigarettes. And a pipe increases your risk of developing cancers in the mouth, lips, and the throat. So let's look at smokeless tobacco, which is a tobacco that is sniffed through the nose or held in the mouth or chewed. Now, smokeless tobacco contains nicotine in addition to 28 carcinogens. It is absorbed into the blood through the mucous membranes and through the digestive tract. Smokeless tobacco is as addictive as smoked tobacco. In addition, it irritates the mouth-sensitive tissues and it causes leukoplakia, thickened, white, leathery-looking spots on the inside of the mouth that can develop into oral cancer. So, how does tobacco affect the body? Short-term effects. It changes brain chemistry. Because the addictive properties is it causes you to crave it. Withdrawal symptoms can be headaches, nervousness, and trembling. It can hit as soon as 30 minutes after your last tobacco use. It increases respiration heart rate. It dulls the taste buds and reduces the appetite. It causes bad breath, causes the hair to smell, clothes to smell, and skin to smell. Long-term effects are chronic bronchitis. Because the damage to the bronchi is you're more prone for infection. And then emphysema, which is the destroying of the tiny air sacs at alveoli in the lungs. It can cause lung cancer. When the cilia of the bronchi are destroyed, extra mucus cannot be expelled, and cancer cells can grow. Coronary heart disease or stroke. Nicotine constricts blood vessels, which cuts down on circulation or blood flow. Nicotine also contributes to plaque buildup in the blood vessels. As a teen, there's other consequences. There's legal consequences. Selling tobacco products to a person under the age of 18 is illegal in all states. And also schools prohibit the use of tobacco products on school property. Social consequences. Many people find secondhand smoke and the smell of tobacco offensive. So tobacco users may be excluded from social gatherings. And then financial consequences. The use of tobacco products can be very expensive. Someone who smokes a pack of cigarettes a day can spend more than $2,000 a year on cigarettes. Some reasons that teens choose to give up tobacco, they begin having health problems such as asthma or respiratory infections. They have the desire, will, and commitment to stop. They realize how expensive it is. They realize using tobacco can lead to other riskier behaviors such as alcohol and other drugs. They find it difficult to purchase tobacco products because they are under the age of 18. And they realize the damaging effects of secondhand smoke and don't want to put their family and friends in harm's way. When you stop using tobacco, you'll go through nicotine withdrawals, which is a process that occurs in the body when nicotine, the additive drug, is no longer used. For some people, to lessen the effects of withdrawals, they'll use nicotine substitutes, which is a product that delivers small amounts of nicotine into the user's system while he or she is trying to give up tobacco habit. This is in the form of patches and gums. People who try to give up tobacco can try some of the following. Prepare for the day. Start a target date for quitting. Get support and encouragement from friends and families. Identify available health-related services in your community. Replace tobacco with the use of healthier alternatives. Change daily behaviors. Avoid other tobacco users, preparing one's environment to be tobacco-free. And engage in a healthful lifestyle. Physical activity, good nutrition, stress management techniques, and abstinence from alcohol and other drugs can help you with the withdrawal process. So now we're going to talk about risks for non-smokers. You have environmental tobacco smoke, which is secondhand smoke, which is air that has been contaminated by smoke. You also have now what they call third-hand smoke, which is the smoke that is present on clothes and on furniture and on fabrics. and that can be damaging, especially to young people. So environmental tobacco smoke is composed of mainstream smoke, which is the smoke exhaled from the lungs of a smoker, or side stream smoke from a burning end of a cigarette, cigar, or pipe. Side stream smoke is more dangerous than mainstream smoke because it has higher concentrations of carcinogens, nicotine, and tar. So effects on non-smokers. Effects of smoke on young children. They have higher incidence of sore throats, ear infections, and upper respiratory problems. And they also risk developing lung cancer. Next, we move on to chapter 22, alcohol. So some facts about alcohol. Ethanol, which is a type of alcohol that is in alcoholic beverages, is created by fermentation of fruit, vegetables, and grains. Fermentation is the chemical action of yeast and sugars. Alcohol is considered a depressant, which is a drug that slows down the central nervous system. If you consume too much alcohol, you become intoxicated, which is a state in which the body is poisoned by alcohol or another substance, and the person's physical and mental control is significantly reduced. Factors that influence the use of alcohol. 1. Peer pressure, families, and also media messages. So alcohol in unsafe situations. So alcohol in the law. If you're under 21, it is illegal to buy, possess, or consume alcohol. Alcohol, violence, and sexual activity. Alcohol use and sexual activity are a dangerous mixture. Alcohol impairs a person's judgment, lowers inhibitions, and compromises moral standards. Teens who use alcohol are more likely to become sexually active at an earlier age. And alcohol abuse. It is estimated that 25% of all youth are exposed to family alcohol abuse, which is the excessive use of alcohol, at some time prior to the age of 18. Being alcohol free allows you to maintain a healthy body, make responsible decisions, avoid risky behavior, and avoid illegal activities. So the short-term effects of alcohol are different for each individual. Some factors that influence the onset of these effects include body size and gender. A small person feels the effects of the same amount of alcohol faster than a larger person does. In general, alcohol moves into the bloodstream faster in females. Next, food. Food in the stomach slows down the passage of alcohol into the bloodstream. And then amount and rate of intake. As the amount of alcohol consumed increases, the level of alcohol in the bloodstream also rises. When a person drinks alcohol faster than the liver can break it down, intoxication results. If you consume it too fast, alcohol poisoning can occur. So alcohol and drug interactions. When a drug enters the body, it travels through the bloodstream and it targets organs and tissues. Over time, the body metabolizes the drug. Alcohol travels through the bloodstream to the brain. At the same time, the liver metabolizes the alcohol in the bloodstream and makes it less active. So short-term effects of alcohol on the body. On the brain, it becomes less able to control the body. Movement, speech, and vision are affected. Memory. Thought processes are disorganized, and memory and concentration are dulled. Judgment is altered and coordination is impaired. Blood pressure to decrease and heart rhythm becomes irregular and a risk of cardiac arrest increases. Blood vessels begin to expand, increases the surface of the blood vessels and allows heat to escape the body and causes the body temperature to drop. It causes the stomach to produce more acid, which can sometimes result in nausea and vomiting. Toxic chemicals are released as the liver metabolizes alcohol. These chemicals cause inflammation and scarring. In kidneys, alcohol causes the kidneys to increase urine output, which can lead to dehydration. Lungs. Carbon dioxide formed by the liver is released from the body through the lungs. Alcohol depresses nerves that control involuntary functions such as breathing. If an excessive amount of alcohol is consumed, breathing may slow, become irregular, or even stop. Alcohol may also slow down the absorption of other drugs into the body. Frequent drinking may increase the number of metabolizing enzymes in the body, which can cause medications to be broken down faster than normal, decreasing their effectiveness. Metabolizing enzymes can change some medications into chemicals that can damage the liver or other organs. Alcohol can increase the effect of some drugs. Under the influence. A person is said to be intoxicated when his or her blood concentration exceeds the state's legal limit. Blood alcohol concentration, or BAC, is the amount of alcohol in the person's blood expressed as a percentage. So some side effects is it slows reflexes. It reduces a person's ability to judge distances and speeds, increases risk-taking behaviors, and it reduces a person's concentration while increasing forgetfulness. Consequences of a DWI: harm to the driver or others, restricted driving privileges, alcohol-related injuries, property damage, death, living with regret and remorse from the consequences, loss of parental trust and respect, arrest, jail time, court appearances, and a heavy fine or bail, police record and possible lawsuits, and higher insurance rates. Binge drinking, which is drinking 5 or more alcoholic drinks at one sitting. Alcohol poisoning, which is a severe and potential fatal reaction to an alcohol overdose. Alcohol is a depressant and shuts down involuntary actions such as breathing and the gag reflex that prevents choking. A fatal dose of alcohol will eventually stop these involuntary actions. It's common that a person who has consumed too much alcohol to vomit because alcohol is a stomach irritant. Passing out is a common effect of drinking too much alcohol. Alcohol doesn't stop entering the person's bloodstream after he or she passes out, however. So symptoms that indicate alcohol poisoning: mental confusion, stupor, coma, inability to be roused, vomiting, seizures, slow respiration, 10 seconds between breaths or fewer than 8 breaths per minute, an irregular heartbeat, hypothermia or severe dehydration, If a person exhibits any of these signs, you need to call 911 immediately. So long-term effects of alcohol is it changes the brain. It causes addiction, loss of brain function, can cause actually brain damage. It damages the heart, it can enlarge the heart, and it causes high blood pressure. It can cause fatty liver disease, alcohol hepatitis, which is inflammation of the liver, or cirrhosis, which is when liver tissue is replaced with useless scar tissue. Digestive systems and kind of irritation in the digestive lining. Pancreas problems. Lining of the pancreas swells and blocks the passage of the pancreas to the small intestines. Alcohol during pregnancy. Infants born to mothers who drink during pregnancy may be at risk of fetal alcohol syndrome, which is a group of alcohol-related birth defects that include physical and mental problems. So one of the most devastating effects of alcohol is alcoholism, which is a disease in which a person has a physical or psychological dependence on drinks that contain alcohol. When not drinking, an alcoholic may experience withdrawal symptoms such as nausea, sweating, shakiness, and anxiety. Typically, alcoholism begins with social drinking in an attempt to relax. Then stage 2 is dependence. The person reaches a point where he or she cannot stop drinking and is physically dependent on the drug. Stage 3, addiction. In this final stage of alcoholism, drinking is the most important thing in a person's life. Although alcoholism cannot be cured, it can be treated. The process of learning to live an alcohol-free life is called recovery. As many as 2/3 of alcoholics who try to recover do so with proper treatment. Sobriety is living without alcohol and is a lifelong commitment. Many resources are available to help people who have a drinking problem. All right, next we're going to talk about medicines and other drugs. And so first let's talk about different classifications. We have medicines, which are drugs that are used to treat and prevent diseases or other conditions, and drugs, which are substances other than food that change the structure or function of the body or mind. So medicines can be sorted into 4 broad categories. Ones that help prevent diseases, ones that fight pathogens or infectious agents that cause disease, ones that relieve pain, and ones that help maintain or restore health and regulate the body's systems. So we have medicines to prevent diseases. Those are vaccines. Vaccines. A vaccine is a preparation introduced into the body to stimulate an immune response. These medicines contain weakened or dead pathogens that stimulate your body to produce specific antibodies against those pathogens. They have antitoxins. These extracts of the blood contain antibodies and act more quickly than vaccines. Medicines that fight pathogens. Antivirals and antifungals. Antibiotics have no effect on viruses. However, a new group of drugs called antivirals have been developed to treat some viral infections. So you have medicines that relieve pain. These are called analgesics or pain relievers. Analgesics range from mild medicines like aspirin to strong narcotics like opium-based morphine or codeine. Medicines that promote health. We have allergy medicines. We have body regulating medicines that maintain the body's chemistry, like insulin for diabetics or inhaler for asthma, antidepressants, and antipsychotic drugs. These medicines help normalize brain chemistry. Cancer treatment drugs. These medicines reduce rapid cell growth and help to stop the spread of cancer cells. Medicines in the body. Now, a lot of medicines have side effects, which are reactions to the medicine other than the one intended. So problems with taking medicines. We have tolerance, which is a condition in which your body becomes used to the effect of the medicine. Then the body requires an increased amount to have the same effect. Also, you have withdrawals. Withdrawals occur when a person stops using a medicine on which he or she has a chemical dependence. So we have medicine and safety. The FDA has ruled that certain medicines cannot be used without written approval of a licensed physician. These prescription medicines are available only by the means of a doctor's written instruction and can only be dispensed by licensed pharmacists. Over-the-counter medicines is a wide variety of medicines that can be bought without a prescription. So misuse of medicine can be things such as giving a prescription medicine to a person for whom it was not prescribed, or taking another person's medicine. Taking too much or too little of a medicine, discontinuing use of a medicine without informing the healthcare professional, and mixing medicines. So substance abuse is an unnecessary or improper use of chemical substances of non-medical purposes. Many of these are illegal drugs, which are chemical substances that people of any age may not lawfully manufacture, possess, buy, or sell. So consequences of drug use. Physical consequences can be as severe as overdose, which is a strong, sometimes fatal reaction of taking a large amount of a drug. Mental emotional consequences. Drugs can cloud reasoning and thinking, and the users may lose control of their behavior. Social consequences. Even people who are just experimenting with drugs do and say things that they later regret. Now we need to understand the addiction cycle. We have tolerance. You have psychological dependence. We have physiological dependence, which is when a user has a chemical need for the drug. Then addiction is a psychological and physiological need for the drug. Drug use affects all aspects of a person's health, mental and physical. The effects of the drug can also influence emotional health. People who experiment with drugs tend to lose control more readily than those who do not. Legal consequences. Teens possessing, using, manufacturing, or selling drugs are committing the crime of illicit drug use. Consequences on family and friends. Some people believe that their decision about drug use is their own business and doesn't involve anyone else. That's not true. When people decide to use drugs, it affects everyone in their life. Substance abuse can cause considerable harm to developing fetuses, infants, and children of drug users. If either parent is using injected drugs, a baby may be born with HIV caused by the sharing of infected needles. A nursing mother who uses drugs may pass the substance through the breast milk to her child. Now let's talk about marijuana, inhalants, and steroids. So, marijuana is a plant whose leaves, buds, and flowers are usually smoked for their intoxicating effect. As with other mood altering drugs, marijuana raises levels of the brain chemical called dopamine. This chemical produces a pleasurable feeling. In some users, the drug triggers the release of so much dopamine that a feeling of intense well being or elation is reached. And some users may develop paranoia, which is an irrational suspiciousness or distrust of others. As marijuana possesses physical risks to the reproductive organs. In males, regular use interferes with sperm production and lowers levels of testosterone. Females experience the opposite effect, an increase in testosterone. This may result in unwanted facial hair and can lead to infertility. Inhalants, which is a substance which fumes are sniffed or inhaled to achieve a mind-altering state. Anabolic and androgenic steroids, which is a synthetic substance that are similar to the male sex hormone testosterone. We have psychoactive drugs, which is a chemical that affect the central nervous system and alter activity in the brain, changing the functioning of the central nervous system. There are four classifications of psychoactive drugs. There are stimulants, depressants, narcotics, and hallucinogens. Stimulants are things like cocaine, crack, amphetamine, and ethamphetamine. Depressants are barbiturates, tranquilizers, Rufal, or GHB. Narcotics are things like opium, morphine, heroin, or codeine. And hallucinogens are PCP, LSD, ecstasy, or ketamine. Stimulants are drugs that speed up the central nervous system. Depressants are sedatives or drugs that tend to slow down the central nervous system. Narcotics are specific drugs that are obtainable only by prescription and are used to relieve pain. Hallucinogens are drugs that alter moods, thoughts, and sense perceptions, including vision, hearing, smell, and touch. Then we have designer drugs, which are synthetic substances meant to imitate the effects of hallucinogens and other dangerous drugs. How do you get help? So there's treatment centers. Types of drug treatment centers include outpatient drug treatment. These programs usually do not include medication and often consist of individual and group therapy sessions. Short-term treatment. These centers include residential, medication, and outpatient therapies. Maintenance therapy. Intended for heroin addicts, this treatment usually includes medication therapy. Then we have therapeutic communities. These are residences for people with a long history of drug abuse. The centers include highly structured programs and usually last 6 to 12 months. For people who have a serious addiction or for those who are released from a treatment center, drug counseling is usually recommended in either private or group therapy settings. Drug counselors help people adjust to life without drugs. Support groups are a popular strategy for treating addiction because they provide a long-term moral support that the recovering user needs to remain drug-free. That's the end of the drug section.